dear viewers, and welcome to a new edition of our program Africa Today. In today's edition, we are going to talk about Egypt supporting the establishment of a continental platform for innovative financing of the Africa health sector. Indeed, the Minister of Finance, Mohamed, said in a statement that Egypt is keen to support the African Center for Disease Control and Prevention initiative, which aims to establish a continental platform for dialogue on mechanism for innovative financing of the health sector in the African continent. More details in the following story.
Minister of Finance Mohamed said that Egypt is keen to support the Africa Center for Disease Control and Prevention initiative, which aims to establish a continental platform for dialogue on mechanisms for innovative financing of the health sector in Africa. Minister Maid made his statements during a meeting in Cairo with Jean Kaseya, Director General of Africa Center for Disease Control and Prevention. This platform will include African Ministers of Finance and Health, private sector representatives and experts. Maid also highlighted the readiness of the Egyptian Ministry of Finance to provide the necessary technical support to the Africa CDC, which will contribute to its accepted role at the continental level. The minister, who serves as the chairman of the General Authority for Universal Health Insurance, also expressed Egypt's willingness to provide the necessary support in formulating the basic working system of the African Epidemic Response Fund through its membership in the Committee of the 15 African Union Ministers of Finance. Meanwhile, Kaseya stated that the Africa CDC looks forward to making the maximum use of the Egyptian experience at the Universal Health Insurance developing African health system and reducing the risks resulting from disease and epidemics within the framework of mobilizing efforts on the continental level to strengthen African health systems. Egypt's universal healthcare system, launched in 2021, aims at eliminating waiting lists for patients who need critical surgeries and medical interventions within 6 months and uplifting the quality of healthcare services.
World leaders, health groups and pharmaceutical firms announced $1.2 billion in funding at the summit on Thursday to produce vaccine in Africa, which is facing numerous health crises, including rising cholera outbreaks.
World leaders, health groups and pharmaceutical firms announced $1.2 billion in funding at the summit to produce vaccines in Africa, which is facing numerous health crises, including rising cholera outbreaks. French President Emmanuel Macron said at the opening of the summit in Paris that the African Vaccine Manufacturing Accelerator will be an essential step towards a genuine African vaccine market. Macron told the summit that 3/4 of this funding will come from Europe, which was also attended by leaders from Botswana, Rwanda, Senegal, Ghana, as well as visiting ministers, health groups and firms. Germany will contribute $318 million to the scheme. France put in $100 million and the UK $60 million, while other donors include the United States, Canada, Norway, Japan and Gates Foundation. African Union Commission Chief Moussa Faki Mohamed said that the scheme could become a catalyst for promoting the pharmaceutical industry in Africa and fostering collaboration between member states. The COVID-19 pandemic shone a light on the unequal global distribution of vaccines, as wealthy countries home to big pharma firms snapped up most doses, leaving Africa far behind.
To shed more light on the issue, we are very much delighted to be joined over the phone by Dr. Mohamed Al-Aizabi, our political analyst. Good afternoon to you, Doctor. Hello?
Hello?
Yes, Dr. Aizabi, good afternoon to you.
Good afternoon.
Sir, Minister of Finance Mohamed said that Egypt is keen to support the African Center for Disease Control and Prevention initiative, which is aiming to establish a continental platform for dialogue on mechanism for innovative financing of the health sector in the African continent. What's your take on that, sir?
Well, Minister of Finance Mohamed Maid's statement reflects Egypt's commitment to strengthen the health sector across Africa by supporting the African Centers of Disease Control and Prevention, African CDC, initiative. Egypt aims to foster a collaborative platform for innovations, health financing. This move is a significant as underscore the importance of continual unity in addressing health challenges and enhancing resource mobilization and allocation.
Indeed. Also, Mr. Minister Maït highlighted the readiness of the Egyptian Ministry of Finance to provide the necessary technical support to the Africa CDC, which will contribute to its expected role at the continental level. How far is this step beneficial to the whole of the African continent, sir?
Well, the reasons of Egyptian Ministry of Finance to provide technical support to African CDC can be highly beneficial for the continent. Technical support can include expertise in financial management, policy development, and implementation strategies, such as assistance can help build robust health system, improve efficiency and fund utilization, and ensure that resources are directed towards impactful health interventions. Also, Egypt can help African countries in training the nursing system and training doctors by giving them some training in Egyptian hospitals to improve their experience in this field.
Yes, indeed, sir. How do you view the importance of the cooperation among the different African countries to bolster the maximum benefit from this initiative?
Cooperation among African countries is crucial for the success of the African CDC initiative. Collective efforts can lead to shared knowledge pools, resources, and coordinated action against health threats. This unity can enhance the effectiveness of health programs, facilitate large-scale interventions, and ensure a more equitable distribution of health resources across the continent.
Yes, indeed. Sir, actually, do you agree that all countries of African continent have the ability to unite at this difficult time to overcome the health sector crises?
Well, I think that African countries, it's difficult to unite the field of helping and medical treatment and medical aids because of the resources of the field are not enough in the African countries. So they need more help from Egypt and other countries to improve this field and treatment and health programs.
Yes, sir. How do you view the importance of the private sector's role in financing these systems and partnership in order to combat the epidemics and the different diseases in the African continent?
Egypt focuses on enhancing the financial sustainability of African health system as a forward-looking approach. Financial sustainability is critical for ensuring that health services are consistently available and can adapt to emerging health needs. By emphasizing sustainable financing, Egypt aims to build a resilient health system that can provide ongoing quality care without interruptions.
Yes. Sir, how do you evaluate the current position of Egypt in the African continent and Egypt's role in Africa?
The private sector plays a vital role in financial health system and competing epidemics. Public-private partnership can bring in the additional resources, foster innovations, and improve services delivery. The involvement of the private sector can also lead to more efficient health care system by introducing business models that emphasizes cost effectiveness and scalability.
Indeed. Dr. Mohamed Al-Aizabi, our political analyst, thank you so much, sir, for your precious input and for being with us today. And moving on to Sudan, where Sudan is facing a potential famine worse than any seen in the past 40 years. The country is in the midst of a civil war that has seen the two warring factions block aid deliveries that would have a repercussion on the food crisis there.
According to U.S. officials, Sudan is facing a potential famine worse than any seen in the past 40 years. The country is in the midst of a civil war that has seen the two warring factions block aid deliveries that would have its food crisis. With the world's attention largely on Gaza, its plight has mostly gone unnoticed, and if action isn't taken soon, the country's situation, already the world's worst humanitarian crisis, could get even worse. According to Samantha Power, the head of the U.S. Agency for International Development, current data points to a crisis of humongous proportions that is potentially worse than the 2011 famine in Somalia, which killed over 250,000 people. She further suggested that if the situation doesn't change, Sudan could become the site of the worst famine since the Ethiopian famine of 1983 to 1985, which killed roughly 1 million people.
Well, our dear viewers, with that we come to the end of this edition of our program Africa Today. Till tomorrow with another cruise. Goodbye. Many thanks for watching.